And biomarker testing are transforming how doctors can approach colorectal cancer treatment. And despite the benefits, roughly half of all patients currently receive the testing. So joining us now is Dr. Christopher Liu, and gastrointestinal oncologist and Colorectal Cancer Alliance advisor, and also Michelle Capel, a colorectal cancer patient, sharing more on how this can help patients to have a chance for a better outcome long term. Thanks so much for taking time to speak with us this morning. We appreciate it.
Thank you.
Dr. Liu, what exactly are some biomarkers and why are they so important in treating colorectal cancer?
So this is the most exciting time ever for the treatment of colorectal cancer and the personalized therapy for colorectal cancer. But this all starts with biomarker testing. So what are biomarkers? Biomarkers are like a genetic or biomarker or biologic fingerprint for cancer. And so this can include genes or proteins. A lot of times physicians will even say your tumor has this specific mutation. And why is this important? It's because when we know what makes one person's tumor different than another person's tumor, we can start giving patients the right treatment for the right patient.
How does that differ from maybe traditional approaches?
Yeah, when you think about the history of colorectal cancer treatment, it's always been a one-size-fits-all treatment, and that's traditionally been chemotherapy. And so we shouldn't be surprised when one patient has a great response to chemotherapy, but other patients don't have a response to chemotherapy. By doing biomarker testing, we can start to offer targeted therapies or immune-based therapies where we teach the immune system how to fight the cancer for us. Why is this important? It's because it means that we can offer a treatment that oftentimes has better response rates, less toxicity, and most importantly, our patients are going to live longer. So they're living longer and living better with targeted and immunotherapies. But again, that all starts with biomarker testing.
It seems like a no-brainer. Why aren't more patients receiving biomarker testing?
You know, this is a rapidly evolving field, and the advancements in cancer have been just really going at lightning speed. So this is hard for patients, certainly, to keep up with, but even physicians. And so we want to empower every single patient to ask this one question: has my tumor been tested for biomarkers? We want patients to be able to ask their doctors that question. And number two, the Colorectal Cancer Alliance is the largest patient advocacy organization really dedicated to increasing awareness about biomarker testing. They set up a great website, colorectalcancer.org/biomarkers. That's colorectalcancer.org/biomarkers. You can get some great information about what we're talking about today.
Yeah, and Michelle, switching gears just a little bit, I know you were diagnosed with stage 4 colorectal cancer. How has this testing changed your own cancer journey?
So yes, I was diagnosed in 2017 with stage 4 colorectal cancer. Obviously, that was quite a bit of a shock. I was young and healthy. My first appointment, I was given less than a year to live, and that would be with surgery and chemotherapy following. So I was not going to take that and sought further treatment. I saw a specialist, and that specialist explained to me what biomarker testing was, and they were able to do that on a tissue sample for me. And so they were able to find a very, very specific mutation that I have, and they targeted my treatment just for that. So that first doctor that gave me less than a year, well, my new team, I'm still alive, and it's 2025. I should have been gone by 2018, so that just goes to show you how much that targeted treatment does play a critical role in keeping patients alive and thriving, because I am doing well and I am healthy.
And we are so glad that doctor was wrong. Thank you both so much for your time today, and Michelle, especially for sharing your own personal story. Hopefully somebody saw this and it will encourage them to seek some further testing on their own. We appreciate it.
Thank you so much.
Thank you so much.
We